All right, so today we're going to be covering a few different things. So we're going to have two parts. First of all, we're going to talk about how ATAR, UK, and interviews work. Those are the three main things that determine whether you get into medicine or dentistry in WA and in other states. We'll talk a little bit about what courses are available in WA as well as interstate, and we'll talk about, most importantly, what scores are required to get in. I'm going to be joined by two of my friends who are also part of the Academy 99 team, and we'll go through how life is in med school because we're all currently students in the first year of Doctor of Medicine. And in the second part, we'll be talking about a few different tips we have about how you can improve in those three aspects and what Academy 99 can do for you. Okay, so just a few disclaimers before we begin. Not everything is going to be 100% accurate, and the reason for that is some of this stuff is based on prior information, and I completed ATAR back in 2021, so some things may have changed, but I've tried to make it as updated as possible. And there won't be as much information on dentistry as there is for medicine. There's a couple of reasons for that. Number one, I'm more familiar with medicine admissions, and most often people who want to get into dentistry, they also aim for medicine. So there's more information for medicine available on the internet. Okay, let's begin with the ATAR. So how does ATAR begin? ATAR begins in year 11 technically. That's when we say we begin ATAR courses. So in year 10, for those watching who are in year 10, you would have done subject selection, and you have the options to do anywhere between 5 to 7 subjects. In WA, the only subjects that are compulsory are either English, literature, or if you're eligible, English as an additional language. Out of those 5 to 7 subjects, only the top 4 are going to be contributing to your ATAR, unless you have bonuses, which is what we're going to be talking about later. So a thing that makes WA different to the other states is that you don't have to include English or literature in your top 4 subjects. I think in some other states over East, you have to have English, and that kind of makes it harder for a lot of people to get a high ATAR. And there's going to be 2 bodies involved. One is going to be SCARSA and one is going to be TISC, and we'll go through what each of them do shortly. So just to begin with, this is the kind of mark you get at the end of the year from SCARSA, and we're going to go through what each of these sections are and what all of these words mean. So I've just made it a little bit easier to read all of that in this slide. School mark, moderated school mark, exam mark, combined score, standardized combined score. So let's begin with the first one, the school grade. And this is the simple A, B, C, D, E grades that you get throughout year 7 to 12. And the truth is that they don't really have much of an impact in year 11 to 12. They do matter for things called certificates of merit and certificates of distinction. There is a point system, which I'm not going to go through. And the reason for that is there is thousands of people every year who get certificates of merit or certificates of distinction. And the truth is it doesn't really have much of an impact in terms of your career or getting looking good on a CV or anything like that. So for year 11 to 12, the school letter grade doesn't really matter. And by the way, if you have any questions, feel free to pop them into the chat and I'll respond to them as we go on. Okay. When the school grade does matter, that's in year 10. So only students who get past a certain score will be allowed to do certain subjects. but this depends on the school. So I'll give you a bit of an example. I know that at Willerton Senior High, if you get below a certain mark in mathematics, might be around 60 or 70, then they don't really let you do mathematics specialist, for example. And in year 11 chemistry, there's another barrier as well. And that barrier is a certain test at the beginning of the year where you have to, a chemistry test. And if you get below a certain mark in that chemistry test, they don't let you continue with chemistry. So the conclusion is that the school grade only really matters in some schools in year 10 when they might stop you from doing a certain subject. Okay, so let's begin with the first part of our final ATAR score, and that is the school mark. So what is the school mark made of? Okay, the school mark is a number between 0 and 100, and it depends on, well, your marks throughout the year at school. So in case you're unfamiliar with ATAR, it's only a year 12 scores that contribute towards your ATAR. So this is what a typical outline looks like for year 12. We have a few different topic tests, a few practicals or investigations, as well as a semester 1 exam and a semester 2 exam. The weightings I've given here are just an example. They vary depending on the school and depending on the subject as well. Practicals and investigations, again, they vary a lot depending on what the specific subject is. So I think the one I've gone through is my year 12 chemistry outline. You can see that there's a lot of big words over here. I'll just give you a little bit of insight as to what everything is. Topic tests are pretty straightforward. It's just questions about what you've been learning at school. So that includes multi-choice questions, as well as short answers, which might be responding to a prompt. Lab validations and research validations, they might give you some information. You have to do a little bit of research yourself, or you might have to do a practical and you have to answer questions about that. Practical assessment for year 12 chemistry, that's one where you perform an experiment yourself or a process yourself. It's called a titration. And then you can see that the rest of them are pretty much the same. So this was my outline in year 12, and you can see all of my scores there. Yeah, there's a lot of variability, since everything has a different weighting. If you get a low score at the beginning of the year or even later in the year, it shouldn't discourage you from continuing to try your best, okay? Because everything has a different weighting. So at the end of the year, if you calculate your weighted average, it's going to be converted to a school mark. So in my case, when I did chemistry back in 2020, my weighted average was 92.38. The thing that I found a little bit annoying is that when this is used to calculate my ATAR, it gets rounded to the nearest whole number, which is 92 in my case. So I kind of lost 0.38%. If somebody's weighted average was 91.55, they would have gotten the same school mark of 92. So what is a moderated school mark? The school mark gets converted to a moderated school mark through a process called moderation. So what is moderation? It's kind of to help ensure that different schools are consistent in their tests. So as an example, have a look at this table. I'll explain what it is. So if we look at the cohort average being 85 for the school mark, what does that mean? It means that all of my peers, so maybe the 150 people, throughout the year, our average was 85. However, in the WACE exam, we had an average score of 73. So what is this kind of telling? SCARSA, the authority? It's kind of telling them that our school is making the tests a little bit too easy. Everybody was averaging, our cohort average was 85 at school, But in the WACE exam, we only got 73. So as a result, our moderation is going to take us down. So that's why you can see in the school, if your school mark was 88, but the statistics show that your school made the tests a little bit too easy, you're going to get moderated down. Okay, so that gives us our moderated school mark. So in my case, what happened? It went up. So the cohort of people in my year, we did better in the WACE exam, the final exam, than we did throughout the year. And it told SCASA, the authority, that our tests were a little bit too hard. So we got moderated upwards. Okay, the next one is quite simple, examination score. And that's your score in the WACE exam. What is the WACE exam? It's that exam you have at the end of year 12, after all of your school assessments. So what you can see here is just very simply the exam score. What's the difference between school assessments and WACE exam? School assessments, there's many of them. You have all the tests, investigations, semester 1, semester 2 exam we talked about earlier. Whereas for the WACE exam, we only have one, but some subjects, such as a language other than English, I did French. I had an oral exam for that as well. I think there's some music subjects that have practicals as well. But yeah, you can see the differences. School assessments are occurring throughout the year, whereas the WACE exam is just at the end. School assessments are going to be different between schools, whereas the WACE exam is going to be the same for every single student in the state. There is a little bit of a thing here. So some schools, they buy their semester 1 and semester 2 exams from companies such as WAEP and WATP, WA exam papers and WA test papers. So this means that students at Willerton Senior High School and Rossmoyne Senior High School, they may be doing the same semester 1 chemistry year 11 exam, just as an example. And yeah, this does kind of open the door for a little bit of colluding or cheating if somebody does the exam earlier. But yeah, that's not the most ethical way to go about stuff. Okay. So once we've got our moderated school mark and we've got our examination mark, we end up with our combined score. So this is simply a 50-50 of the moderated school mark and the examination mark. And you can see that calculation there. And finally, the combined score is converted to a standardized combined score through a process called standardization. So what is standardization? Well, the role of standardization is simply to make sure that the average of the cohort is close to 60 and the standard deviation is close to 14. If you're familiar with the normal distribution, it's kind of just to make everybody's scores fit the normal distribution. And there is actually a little bit more of a change that goes on. So I will talk about that, but first of all, let me just introduce you to the two authorities that are responsible for ATAR exams. The first one is SCASA, and the second one is TISC. So what do each of them do? SCASA is the authority responsible for creating the exams. So SCASA has teachers, they write the exams, as well as administering them. So what does that mean? It means that SCASA employees are the ones who run the exams at all the different schools around WA. And once they run the exams, SCASA is responsible for the marking, as well as the statistical processes, moderation and standardization. So what is TISC responsible for then? TISC takes the standardized combined score from SCASA, and it's going to do a little bit of an extra thing called scaling, which I'll talk about in a couple of slides. It's going to calculate something called the TEA, which again, I'll talk about in a couple of slides. And finally, it's going to release the ATAR. Now, TISC also deals with university applications in Western Australia. So TISC is going to be the one giving you your ATAR and telling you whether you got into uni. So just to recap the entire process. Here we have the weighted average, which is what you averaged at school throughout the year in a certain subject. So in my case, I averaged 92.38 in chemistry at my school. It was rounded to the nearest whole number. Then it went through moderation by SCASA to get the moderated school mark. Then I sat my weights exam at the end of the year, which again was authorized by SCASA. The moderated school mark and the examination mark were taken as a 50-50 to give the combined score. The combined score again underwent standardization by SCASA to give the standardized combined score. And now the new thing in this slide is what we call scaling. Scaling is done by TISC, and that converts it to a slightly different number. And that slightly different number, called the scaled score, is the one that's going to be used. It's the one that's going to be used in the calculation for your ATAR. And that's all done by TISC. So what even is scaling? Scaling is kind of notorious because people complain about it a lot. And scaling is different for every subject. So here's what the TISC website says about scaling. Scaling ensures that students aren't disadvantaged if they choose a difficult course, not advantaged if they choose an easy one. So here's an example. The example that I like to use is actually Mathematics Specialist, which is the hardest mathematics subject in ATAR, and Mathematics Applications, which is the easiest mathematics ATAR subject. So if we look at Mathematics Specialist, getting a 90 in Mathematics Specialist is kind of it's more of an achievement than getting 90 in Mathematics Applications. So what does scaling do? Scaling is going to take that score of 90 in Mathematics Specialist, it's going to go upwards. And that score of 90 in Applications is not going to change as much as the specialist score. So this quote over here is taken directly from the TISC scaling document. If the engineering studies students as a group perform better across all their courses, the engineering studies marks will generally be scaled up relative to accounting. So the purpose of scaling is to kind of reward the courses that are kind of more difficult. So what's the one used in the ATAR calculation? It's going to be that TISC scaled score. Earlier I mentioned the TEA. What is the TEA? The Tertiary Admissions Aggregate. And it's going to be a number out of 430 that's going to end up resulting in your ATAR. In order to calculate the TEA, the scaled score for the top 4 subjects is added. And as I said earlier, that doesn't include English or literature. It's simply your top 4 subjects. And also there is a 10% bonus for mathematics methods, specialists, as well as languages other than English. I will talk a little bit about that in a few slides because that bonus is actually going away in a couple of years' time. So here's some example scores that a student may get. So how can we calculate the TEA? First of all, let's just have a look at the top 4 subjects, and we're going to add the final scaled score for those 4 subjects up. We add a 10% bonus for methods because this student did methods, and we'll add a 10% bonus for French because any language other than English also gets a 10% bonus. Now, what you notice here is that method specialist or language other than English doesn't have to be in your top 4 in order for you to get the 10% bonus. So even if somebody got a 50 in French, they would get a +5 added to their TEA. So for this student, their TEA ended up being 341.2. And once everybody has got a TEA, it's going to be ranked against everybody else in WA, and that ends up giving you your ATAR. And this is the thing that changes every single year, and I'll show you what I mean by that. Last year, a 341.2, so that's pretty much getting about 80 in every subject. That gives you a 98.8. The year before, that would have given 98.65, 98.55, and then in the 4 years before that, it was pretty consistent around 98.5. Now, I would think that there is a little bit of a reason for the increase in the last 3 years, and that's because of COVID. Due to COVID, some universities began early applications, and that means that before the WACE exam, some people already get admission to uni, and as a result, they don't really try as hard in the WACE exams, and ultimately this ends up having a good effect in terms of the TEA. So probably next year, I would predict that this would go to a higher ATAR. Okay, so here's a nice summary table that tells you that converts the TEA to an ATAR. And here's a really complex table that I'm going to talk about a little bit. So let's begin at the bottom with 99.95, the highest ATAR possible. In order to get a 99.95, you needed a TEA of 402.5 last year. So that means you needed to average 100.63, which isn't really possible. So the answer, or the way that you can do that, is you need bonuses. And that's the next 2 columns in this table. If you have 2 bonus subjects, you need to average about 96 to get a 99.95. If we look at a different ATAR, like 99, without any bonuses, you would need to average about 86.5. With 2 bonuses, about an 82.4, which is quite a bit simpler. So in terms of getting into medicine and dentistry, the ATAR that you should be aiming for is at least a 99. And to be quite secure, you would be wanting to get at least a 99.5. So if you're currently in year 10, 11, or 12, or even less, you should be aiming for about an 85 to a 90 in each of your top 4 subjects. So I would say 90 is a good number to aim for. And this is the change that's coming in a few years' time. From 2026, method specialists and languages other than English aren't going to get any bonus. So if we just go back to the TEA, the theoretical maximum TEA, so what is the highest you can get? You could get 100 in your top 4 subjects, giving you 400. An extra 10 if you got 100 in methods gives us 410. An extra 10 for mathematics specialist gives 420, and an extra 10 for a language gives you 430. So currently the maximum possible TEA is 430, but from 2026, when those bonuses are gone, the maximum is only going to be 400. So who is this going to be affecting? It's not going to be affecting the current year 11 and 12 students. I'm not too sure about the current year 10 students. Probably best to ask the teachers about that one. But the year 9 and below students are definitely going to be affected. So what kind of implication does this have for people who aren't in year 11 and 12 yet? It's probably best to reconsider whether you're selecting specialist and LOTE, which means language other than English. Why should you reconsider? Because you're not going to be getting the bonus for that. I have put a note here that's kind of my prediction. I'm predicting that people who do specialist and probably the language other than English, they may be scaled upwards because those subjects are generally quite difficult compared to the other ones and hence get positive scaling. Okay, so now let's move on to the UCAT. This section will be going through the different sections of UCAT.
The UCAT is an online aptitude test used to assess medicine and dentistry students in the application for medicine. It's a 2-hour-long test. It has 5 subsections and it's scored between 300 and 900. Your total score is out of 3,600 and your score is received pretty much immediately after the exam because the entire exam is done on the computer in a testing center. So the first section is verbal reasoning. It's 44 questions, it's 21 minutes, and it's generally considered the most challenging section in the UCAT, given its time-pressured nature. So the questions are generally grouped into clusters of 4 questions, where you're reading a block of text, so a passage, and then you're answering questions about it. Whilst this might sound simple, what makes it difficult is how quickly you have to read the passages and then answer the question. So retaining a lot of information from what you've read in a really short amount of time. So here's an example of a verbal reasoning question. And as you can see, there's usually 4 questions to each passage. So here's an example of a passage. So in this section, you can expect around 8 to 10 passages. So reading 8 to 10 passages in 40 minutes and answering questions on them can be pretty tricky. The next section is decision making. So decision making has quite a variety in difficulty and also in style of questions. So there's 29 questions and they're done in 31 minutes and mostly focusing on logic problems. And some questions can have multiple parts. So here is an example of a question. These questions can be tricky because they don't often follow the rules we follow in English, and they can often seem like nonsense, but it's sort of testing your ability to logic and reason things out given facts and statements, which is obviously important as a doctor. Here is another style of question. And here is another one. So as you can see, different styles of questions. The next section is quantitative. So quantitative is focused on maths. It can be easy or difficult depending on your maths ability. Unlike what you do in year 11 and 12, however, I think the highest difficulty of maths you can expect in terms of knowledge is probably at worst a year 9 or year 10 level. So this is also relatively time pressured, having to do 36 questions in just 25 minutes. Examples include interpreting tables, interpreting graphs, and a lot of mental maths problems. You do get an on-screen calculator, but in my experience, as well as many others, using the calculator can waste a lot of time and possibly reduce your marks. So I recommend you get really good at your mental maths. So here's an example of a quantitative reasoning question. Working with tables is often a common question type. The next section is abstract reasoning. So this one is arguably the most time pressure section, having to do 50 questions in just 12 minutes. This is looking at things like pattern recognition, and it's the same as many aptitude tests. So I believe there's a similar section in GATE. There's 9 sets of 5 questions where there's the same pattern and we're finding out, identifying the pattern and answering questions. and then 5 standalone questions of a similar type. So here is this example of a set, or an example of a question set, and then 5 questions that might follow. So figuring out if the test shapes fit into either set or neither. And here is a standalone question. The last section is situational judgment. This one's the least time pressured, and in my opinion, probably one of the easiest sections. It's 69 questions, 26 minutes, and this is thinking about making decisions about ethics and behavior in different situations. Usually the situations are focused on being a medical student, doctor, dentist, but they can also go into just general life questions. So some scenarios might be related to multiple questions. However, most unis don't actually factor it in to your final UCAT score at all, or just have a simple 50% minimum requirement. So I think of all the sections, it's definitely the one to worry the least about. Here's an example of a situational judgment question. So the scoring in UCAT can be a little complicated. So your score is out of 3,600, as I said earlier, and it's converted to a percentile in September once everyone has finished the UCAT for that testing period. So looking at the deciles here, the general requirement to get in the 90th decile, which is probably what you'd want to be aiming for entry into medicine, is about 3,000 out of 3,600. Also keep in mind that the situational judgment score is calculated, is given separately. So people have strengths and weaknesses, just like with ATAR. You don't have to be perfect in every section. Someone who scores really highly in quantitative reasoning can do slightly worse in verbal reasoning, and that is the case with most of us, I think. So in June or August, you'll get your score almost immediately out of 3,600, but often the score doesn't mean much because what we really care about is your percentile, which will come in September once everyone has finished testing. Okay, so looking at some scores, your raw score isn't given to you out of how many questions you got correct. Only a score out of 900 is given, since each question can have a different point value out of the 900. And another thing is that you won't get the same questions as your friends, since all the questions come from a bank of questions at random. The table on the left is a rough estimation of how many questions you need to get correct in each section to get that estimated point score out of 900. So the worst thing about UCAT is that it gets harder and harder every year. So the reason I say that, we can see in the statistics here. So back in 2019, the requirement to get a 90th percentile was just 2,850 out of the 3,600. In 2020, it increased to 2,920, and it's increased sort of at that rate every year since. So 2023, it's sitting at around 3,000. So I'd expect this year we'd probably want to be aiming for about 3,050 to get a 90th percentile. And probably the main reason I predict for this is that given that the UCAT was a pretty new test in 2019, so it was introduced in 2019 when it was brand new, so there wasn't a lot of practice material and a lot of people didn't get the chance to practice. But as the years have progressed, people have been practicing, especially people from year 9 and year 10, getting practice questions in and have managed to improve their score. So every year gets more and more competitive.
All right, so the third and final entry requirement we'll be looking at is the interview. And the offers for your interview are based off of your ATAR or predicted ATAR. We'll get into that in a second. Your UCAT, and in some cases, additional tests such as the CASPER test. And the weighting of these 3 requirements depends on the uni itself. So some unis may consider ATAR more important to give you an interview offer. Some unis may consider ATAR and UCAT at the same 50-50, or some may consider other tests such as Casper. Now, the interview format is usually an MMI, which stands for a multiple mini interview. And what this is you have multiple different stations, and each station has a scenario. The scenario may be to ask what you would do in a certain situation, or it may ask about personal experiences you've been through, or general questions like how you would act in a leadership scenario. And usually the interviews are around 5 minutes per station, and then you will transition from one station to the next until you've gone through all of them. Now, for the interviews, there are no correct answers, just very open-ended questions. Now, sometimes the scenario that's posted at the door before you enter, it may be simple. So in this case, a third-year medical student posts negative remarks about a consultant at the hospital on a private group on Facebook. Is this okay? Does it matter that the group was private? And what should have the student done? So this is a fairly simple prompt, whereas sometimes it can become complex. So in this case, a patient presents at the hospital having an asthma attack. She is asked but refused to be examined by a medical student, is seen and treated by a doctor. And the question is, what are the issues around patient/volunteer participation in training medical students and junior doctors? So you can imagine in the 2 or so minutes you have to, or maybe not 2 minutes, in the couple minutes you have just before entering the room, when you have to think about your answer, you can imagine this one may be a hard one. All right, so now we'll be going through the timeline for interviews. Okay, timeline for interviews and UCAT and ATAR as a whole.
All right, so yeah, we're just going to be going through the year and how all of this stuff, when is it all occurring? When is term 1, term 2? When is your UCAT going to be? All of that. So term 1, school begins in February and it goes for about 10 weeks. I think this year, the first term is about 9 weeks. Then you have your normal 2-week break. This is in the timeline for year 12, by the way. And in term 2, that's when the semester 1 exams happen. And they depend on the school. They might be anywhere from as early as week 4 to as late as week 7. That all depends on the school. And then you have term 3. Now, the thing I didn't include over here, just because it'll make it a little bit complicated, is UCAT. So your UCAT exam, the dates usually begin around the start of July, so end of June or start of July, and they finish in August. So if I go back, if the dates finish in September, so you have about 2.5 months in which you can sit UCAT. But if you're in year 12, the same year as you're doing UCAT, it kind of makes the most sense to sit your UCAT in those 2 weeks between term 2 and term 3. And the reason for that is you're not going to have your school tests going on at the same time, so it makes it a little bit easier. But the issue that kind of comes here is when you're booking your UCAT, so I think March 1 is when the dates for booking open, the good timings get taken straight away. So you have to be really, really snappy. As soon as you're able to book, you have to book in order to get good timings. I managed that. I think I booked about 40 minutes after the bookings were available, and I got a time, I think, in the second week of the holidays. Okay, so once you've done your UCAT and you're in term 3, so towards the end of term 3, that's when you're going to have your semester 2 exams. And again, that really varies depending on the school. Now here I've put week 9 to 12, which is maybe a little bit weird because terms only have 10 weeks. Some schools, they do your semester 2 exams in the holidays, but again, that depends on the school. So for example, my school, Perth Modern, back in 2021, we had our semester 2 exams in week 9 and 10. And following the semester 2 exams, we had our 2-week break, and then we came back for a couple of weeks for term 4. And that's really, I write term 4, but it's not really like a real term 4, because when you go back to school, you don't learn any new content. You're just going back through the older content, and you might be reviewing your semester 2 exams. But more importantly, people are going to be preparing for graduation. You're going to have your graduation right on the Friday, so that would be around the Friday 25, you can see there. So people will be doing a lot of celebrations in that term 4 period, and to be honest, at least half the people don't go to school. So yeah. Now, if you're lucky, depending on your school, if your exams were from week 9 to 10, then you're going to have quite a big break before your WACE exams, which begin at the start of November and finish around 15 to 20 November. And the exact dates change every year, but you can see that you have, depending on when your semester 2 school exams are, you have about 4 weeks break before your WACE exams, and you have no new content in that time. So that's 4 weeks of pure practice exams or pure revision that you can be doing before your WACE exams. Now, on one hand, this is a pretty good thing because you're going to be more prepared for your WACE exams, but on the other hand, it's a bad thing because you have a lot of time in which you can forget all of the stuff. Now, once you've sat your WACE exams, if you're planning to do medicine and dentistry, unfortunately, or fortunately, you're not going to be able to go on any leavers trips if you've managed to get an interview. So the local interviews, meaning Curtin and UWA, are going to be occurring in the final week of November as well as the first week of December. There are different interview rounds as well. So if you don't get a local interview straight away, you might get one in the second round, which is after your ATARs are released. I haven't put it here, but ATARs would be released around 15 to 20 December. If you're looking for interstate unis, those interviews would be in January after your actual ATAR is released. So let's go to interstate unis, but actually just before I do that, I might talk a little bit about the predicted ATAR. So how can local interviews be at the end of November and at the start of December, but your ATAR is coming on the 15th of December? So the answer to that is what we're going to be talking about later. Okay, depending on the uni, the requirements to get an interview are different. So some universities, they offer an interview based on the predicted ATAR. So that's based on either your year 11 results or it's based on your year 12 semester 1 results. Now, if you did bad in year 11, it doesn't really matter because you can still get an interview after your actual ATAR has been released. There are multiple interview rounds. Yeah, so we'll go through the specific interview, how to get an interview for each of the different universities. Now, I'm going to go through all of the different interstate universities, but I'm going to do it very, very quickly. Everybody is going to be able to get a copy of the slides after, so you can have a look in more detail. But just for the purpose of saving time, I will go through all of the interstate unis quite quickly. So just to begin with, let's look at the types of degrees for medicine and for dentistry. For medicine, we have the MBBS and the MD. MBBS stands for Bachelor of Medicine, Bachelor of Surgery. So MBBS is much easier to say. MD stands for Doctor of Medicine. There is a little bit of a difference in between these. So when you do the MD, you have to do a bachelor's degree before it. Whereas the MBBS you don't really have to do any degree before that. The length is usually about the same, anywhere between 5 to 7 years, but that depends on the university. In Australia, the type of degree, it doesn't really have an impact. And the university prestige doesn't really have an impact either. So I'll be talking about it later as well, but Curtin and UWA, which one you go to, it doesn't really have much of an effect in terms of employability. There are a few differences we'll talk about after. So now if we look at dentistry degrees, it's again kind of similar. You could do a bachelor's degree and after that a doctor of anything, a doctor of, for example, I think there's doctor of dental surgery or doctor of dental medicine or master of dentistry. That all depends on the university. And the other option is that some universities offer just a simple bachelor degree that is 5 to 6 years, Bachelor of Dental Science or Bachelor of Dental Surgery. In either case, again, it doesn't really have an impact what type of degree it is. You become employed as a dentist at the end. Okay. Again, the university prestige doesn't really matter. If you get an offer, then they're all the same. Okay, so some people might have heard about bonded medical program, and that's it's a scheme by the Australian government to address the shortage of medical professionals in remote areas. So that's actually one of the major problems in medicine. And when you do interview preparation, that's often you'll see that that's often quite a theme, an important theme in some universities. They really want you to think about the remote communities and all the problems that exist in them. So the bonded medical program, what is it? It means that when you get a spot in medicine, you have to practice in a regional/remote area for a certain amount of time. Nowadays, it's not necessarily a bad thing, and the reason for that is the government is offering significant HECS reductions. So HECS is that debt you have to pay for uni. It'll be about 10K every year, unless you're an international student. So these days, there's a lot of incentives to address the problem that doctors aren't going to rural areas. So there's the HECS debt reduction, but you also get paid quite a bit more, especially GPs. So if you're not opposed to going to a rural area, then the bonded medical program, if you get an offer, a bonded medical spot, then that's not necessarily a bad thing. Now, by default, BMP spots are allocated to the bottom 28.5% of applicants. Okay, so I just said that before, but yeah, better pay and HECS wiped. It's kind of a bit of a blessing, and you're doing the community a service, and that's really what medicine is. There are two other types of spots, Commonwealth supported places and full fee paying. You might see these, but CSPs are the ones that are going to be applicable to most people, and that's what this presentation is about. It's the normal kind of subsidized one by the government. Okay, let's quickly go through each of the different states. So when you apply to uni, you have to apply through a different website for each of them. You can see I've listed them all here. You can have a look afterwards if you would like. Some unis you have to apply direct. Let's go to New South Wales Dentistry. There's two unis in New South Wales offering dentistry, Charleston and University of Sydney. I'm going to skip through all of them. I'm going to only point out the notable ones, the ones that have something special. But you can have a look at those slides afterwards. University of Sydney Dentistry, I guess it's kind of special because it doesn't have UCAT, but you do need a really high ATAR. New South Wales Medicine, you have so many available. JPM, Joint Program in Medicine, is between two unis, Western Sydney and Charles Sturt. This one is very, very, very difficult to get into because they don't really look at your UCAT score in terms of percentile. They have their own weighting system, and it has a very strong weighting on verbal reasoning. And additionally, there's a strong preference for GWS students. Those are students from Greater Western Sydney. The people living around where the uni is in Western Sydney. So it's really, really hard for WS students. Unless you do really, really good in verbal reasoning, you can pretty much count yourself out of the JPM, Joint Program in Medicine. Similarly, you have the JMP, Joint Medical Program, between University of New England and Newcastle. What is special about this one is that the ATAR is a hurdle. So what does hurdle mean? It means that a 95 ATAR is going to be treated the same as a 99 ATAR. Okay? It's simply just a hurdle to pass. But again, unfortunately, there's a strong preference for the New South Wales or ACT students because ACT doesn't have any unis offering medicine or dentistry. UNSW, pretty difficult to get into, harder than our local ones. University of Sydney, I will talk about this because again, it's a little bit of a special one. You don't need to do UCAT for this, but you do need 99.95, and that is quite difficult. I did put a note at the bottom. WS students are automatically eligible for EAS, Educational Access Scheme, if you live in a rural or low income area. Now, you might think that means you have to live in like Mandurah or Albany or somewhere far, but there are a few suburbs within Perth that fit under the EAS scheme. If you want to know more about that, then you can Google that. For example, Maddington is a suburb that people who live in Maddington would be eligible for the Educational Access Scheme, which means for for University of Sydney, you'd only need a 99.5, which is significantly easier than 99.95. Yeah, I mean, I think most of the people watching this will be from around the Willetton area. Willetton, Rossmore and Shirley, these suburbs don't fall under low income areas. Here's a little bit of a new one, which we don't have much information about. Victoria Dentistry, La Trobe University, very difficult, much easier in WA. University of Melbourne, I'll talk about when we go through medicine. So Victoria Medicine, this is Monash University, quite reputable because it's one of the highest ranked degrees, highest ranked universities in Australia. It is quite difficult to get in for WS students because of the strong preference for Victorian students. What is a better option in terms of scholarship than Monash is the next one, University of Melbourne. So technically there's no real medicine program at the University of Melbourne, but instead there's a thing called the Chancellor's Scholarship. And if you're doing ATAR, then this is what you should be aiming for if you want the highest rank possible, or the highest goal possible. So what is the Chancellor's Scholarship? It means you can do any undergraduate degree, you could do engineering if you like, and you can get into any postgraduate course that you like. So whether that is Doctor of Medicine, Doctor of Dental Medicine, or maybe you want to do a master's in engineering, you can get into it for without having to satisfy any of the requirements. So in terms of getting into Doctor of Medicine, you don't have to do the UCAT or the GAMSAT, which is the postgraduate entry test. Now the problem is you do have to pass an MMI, so that's the type of interview we talked about before, after the 3 years of your undergraduate degree. But I've never heard of anybody failing the MMI. So if you get offered the Chancellor's Scholarship, then you shouldn't necessarily be scared about failing the MMI. Another really important thing here is that the HECS for the undergraduate degree is wiped. So that's approximately $30,000, and you get your $10,000 per year for the first 3 years as part of the scholarship, meaning overall this scholarship is worth about $60,000. So, or at least $60,000. That's quite a significant sum of money, and this is the most prestigious scholarship in Australia. It is automatically offered to anyone who gets at least 99.90. Okay. Again, I'm not going to go through this. Flinders is a little bit special because you don't have to sit an interview, but unfortunately you do need quite a high ATAR. You need pretty much a perfect ATAR and a very good UCAT as well. Tasmania only has medicine, and again, there's no interview, but it's really hard to get in. For Queensland, there's so many available that I haven't bothered to go through them individually. I'll point out the ones that are important. If we look at University of Queensland Dentistry, it's a little bit special because it looks at situational judgment in terms of the UCAT as well. But the requirements are quite high, definitely higher than they would be in Western Australia. Queensland Medicine is where we get two very interesting universities which are worth looking into. So first of all, I'm going to go for the one on the right, Griffiths University. There is no interview and no UCAT, so they only look at your ATAR. But you have to get 99.85, and that's going up every single year. So I would estimate that in 1 or 2 years, it would be a minimum 99.90. Griffiths University does have a partnership with University of Sunshine Coast. Griffiths University has two campuses, one in Brisbane, one in Gold Coast. USC, or University of Sunshine Coast, is a few hours north of Brisbane, and it's a little bit more regional, hence the lower ATAR requirement. I mean, I say lower, but 99.8 is still extremely difficult, as is 99.85. And the one that is very, very famous is the one on the left, James Cook University. And the reason for this is it doesn't have a UCAT, it has an interview, but it has a very special aspect to it, which is the written application. So to apply to James Cook University, you don't have to sit the UCAT, you do have to sit the ATAR, and typically you do need about a 99 plus ATAR. But yeah, the special thing about it is the written application, which has a lot of different questions. You can have a look at that on the internet if you're interested. Your rurality, so where you're doing high school, is also factored in. Actually, I'll go back for a second. I will say JCU, James Cook Uni, that's located in Townsville, which again is in regional Queensland. But often people who go to JCU, they don't get offers from other universities. And it's a very famous one. It has a lot more applicants than other universities, simply because it has a weighting on a written application similar to American colleges, rather than the UCAT. Okay, what is the conclusion of looking at all of these interstate unis? They're quite a bit more difficult to get into. So if you want to go interstate, then yeah, it will be a little bit harder than getting into a university locally. So I'll spend a little bit more time on our local universities, which are UWA and Curtin. There is another university that offers medicine in WA, that's Notre Dame, but it doesn't offer undergraduate medicine. So in this presentation, we'll only go through these two. And dentistry is only available at UWA. So to begin with, let's look at dentistry at UWA. What's it like? It's a Bachelor of Biomedicine followed by a Doctor of Dental Medicine. It's 6 years long. And in those first 2 years, you'll be together with the medicine students, the dentistry students, and the podiatry students. In the first 2 years, they will all be doing the same content. In those first 2 years, there will be 4 units or 4 subjects per semester. Of those 4 subjects, 2 out of 4 will be related to biomedical sciences. The remaining 2 out of 4 will be related to whatever you like because they're electives. So, for example, I chose to do some law electives and some finance electives and statistics, mathematics, whatever you like, you can do. And in the next 4 years, after the initial 2-year period, the MD, which is medicine, DMD, which is dentistry, and DPM, which is podiatry, those students are all separated. So what do you need to get into dentistry? The interviews will be based only on the UCAT score this year. And the interviews will be in the period between 25 November and 8 December. As I said earlier, the final week of November and the first week of December. While your interviews are solely based on your UCAT, the final ranking will be based on ATAR, interview, and UCAT. And the most striking thing here is that the interview is worth 50%. This is an increase from previous years. So back in 2021, the interview, it was either weighted at 40% or 33%. I can't remember. But the point is that there has been an increase. Chemistry is a prerequisite, but you can get in without doing chemistry because it can be taken as a unit during the first 2 years. So it's not a real prerequisite. So interview 50%, that's the main thing over here. And it's going to be the same for medicine. But why is it really, really important? Because the interview weighting is so high, predicting the scores you need is really, really, really difficult. Now, at the bare minimum, this is a bare minimum that I've put here, you would need a mid-98 ATAR and an 80 plus percentile UCAT with a virtually perfect interview. For dentistry, it wouldn't be as hard as medicine, but these statistics, I mean, it's still quite difficult in WA. Again, I'll say the stuff I put here is the bare minimum. Okay, a person who gets these scores would have to have a very perfect interview. So it's more realistic to get a low 99, like a 99.2, 99.3, mid to high 80 UCAT, so at least 85. That's what most students get. If you live in a regional remote area, then look into the Broadway program, or you go to a school with a low socioeconomic score, then again, your requirements are quite a bit easier, but you still need a 98 ATAR. Medicine, very similar to dentistry. Okay, your first 2 years, you do the same stuff as the dentistry students, and in the next 4 years, you're separated from the dentistry and the podiatry students. So what's the course? It's a Bachelor of Biomedicine and Doctor of Medicine after that. Now, it is technically a 3-year degree, Bachelor of Biomedicine, and a 3-year Doctor of Medicine. However, it's a little bit special because in the 3rd year, so as you can see at the bottom of this slide, in the 3rd year, the undergraduate students, so those are the school leaver students, they join the postgraduate students who are in their 1st year of Doctor of Medicine. For postgraduate students, the Doctor of Medicine is 4 years rather than 3 years. And for that reason, if you're in the 3rd year of Bachelor of Biomedicine, it's essentially the 1st year of Doctor of Medicine. I think I have a slide on this, which will make it clearer. 240 places. Because of all the quotas, it comes down to 100 for school leavers, for normal school leavers. Again, bare minimums mid-98 and 80 plus percentile UCAT. Now, in previous years, you needed at least a 99. They wouldn't even consider your application if you didn't get a 99. Recently, that's been changed to a 98. I think it was in 2022. But still, The numbers I've put here are again, I'll just stress that they're an at least. To be competitive, you would have to get around low to mid 99 and a UCAT that's probably at least 85. But again, with the high interview weighting, it's all really, really difficult to predict this stuff. Once you get in for medicine and dentistry, in your bachelor's degree, so the first 2 years, you do the major integrated medical sciences and clinical practice. And in those first 2 years, you have to maintain a 5.5 GPA. And for students who got such high marks to get into medicine or dentistry, that shouldn't be very difficult. So this is what I was saying before. If the Doctor of Medicine at UWA is typically a 4-year postgraduate degree. Now, if we do an undergraduate plus a postgraduate, you would expect it is 3 years undergraduate, 4 years postgraduate, meaning 7 years overall. However, the school leaver pathway, in the school leaver pathway, your 3rd year of the bachelor degree has become the 1st year of the Doctor of Medicine. So that means the course is 6 years overall, not 7 years, unlike some of the other universities from before, like University of Melbourne, University of Sydney. And that's the year that I'm in right now. I'm in the 3rd year of Bachelor of Biomed, which is kind of the same thing as 1st year of Doctor of Medicine. So what about Curtin? Curtin, the course is different. It's an MBBS. Again, that doesn't matter. The thing that does matter is that it's 5 years long, okay, as opposed to 6 years. So Curtin Uni, how do you get selected for an interview? The weightings are this year, they might change in the future. It's 35% based on your ATAR, 35% based on the CASPA test, which I'll talk about, and 30% on the UCAT. So again, how can we have interview selection if ATARs come out after interviews? It's because it's based on your year 11 predicted, which I think is on the next slide. First of all, what is CASPA? It's just a short online interview used for interview selection. So it's a little bit weird, but it's an online interview. It means you don't have to go in person, and you do get a score. You're put into 4 different categories based on whether you're in the top 25%, the bottom 25%, or in the middle. Last year, most students that I tutored, they didn't think they did very good, but they all ended up being in band 2, which is the 50 to 75 percentile, and they all got interviews. So this is a very, very new thing. It was first introduced in 2023, the CASPA test. You can search it up on the Curtin University website to get a little bit more information about it, but it's very similar to an interview. It will occur in the middle of the year, so I think it's around August. So it will be alongside school, which is a bit annoying. So yes, what I said before, the ATARs are released mid-December, but your interviews are before that. So how does that happen? The year 11 predicted ATAR is used for 1st round interviews. So this is a little bit concerning if you didn't do particularly good in year 11. However, remember that there will be a 2nd round of interviews after the actual ATARs are released. So it doesn't make much of a difference. Now, you can be offered an interview at Curtin with a lower ATAR, with a 96 or a 97, provided you did good in UCAT and in CASPA. The final selection, however, is based on 40% ATAR, 20% UCAT, and 40% interview. So again, we have quite a significant interview weighting. And the final selection won't be based on the predicted, but rather the actual ATAR. So if we look, did I put the scores here? I don't think so. But the scores for Curtin and the scores for UWA are quite similar. If anything, Curtin would be slightly easier to get into. So you'd be looking at probably at least a 99 and at least an 80th percentile UCAT. Or if you do really, really, really good in the interview, you can get in with lower scores. So UWA versus Curtin, let's have a look at the facts. Different degree, different number of years. Some people say that UWA is more prestigious, but there's two things there that don't matter. The MD versus MBBS, the degree doesn't matter. Prestige doesn't matter in terms of getting a job. The stuff that does matter is what I've highlighted. 6 years versus 5 years. Curtin medical students will be 1 year younger when they graduate. And that depends, on the individual. Is that important for you? Then Curtin is beneficial in that sense. The special thing about UWA and Doctor of Medicine degrees in general is that they usually include a research aspect or a scholarly project. So at UWA, in the third year of Doctor of Medicine, we will have the option to do either a research project, which means we can get it published in a research paper, or a scholarly project, which means a few different things. But just as an example, you could do a few units of a different degree, such as a Master of Public Health. And once you graduate, you can finish off that second degree, the Master of Public Health. Why would you do that? Because it might be helpful in specializations as a doctor. However, Curtin and MBBS degrees in general, they don't have that research or scholarly project aspect. Is that important to you? It kind of depends whether you'd be interested in research or not. Electives versus no electives. At UWA, in the first 2 years, you get electives. You could do something completely unrelated to medicine. I did statistics. I did finance. At Curtin, you don't get that option. You have to, everything you do has to be related to medicine. So which one is better? And the answer is, it depends on the individual. Do you want to do electives? Or do you want to just graduate as fast as possible? Do you live close to Curtin Uni, or do you live closer to UWA? In my opinion, the truth is that it doesn't really matter, okay? If you're privileged enough to get an offer for both, then these are 3 factors that you should consider. Okay, so now the 3 who have been talking to you, me, Isindu, and Nathan, we're going to be talking about our experience as UWA medical students and as medicine as a career in general. So just to begin with, I'll go through life in medical school before we talk about our specific experiences. So this is part 2 of the presentation, by the way. Okay, so medical school, as you would expect, it's not really easy. Okay, it is very difficult. But there are obviously a few good things about it, which we'll talk about. One good thing is that you're guaranteed an intern position after you graduate, and your grades don't have an impact on that. The grades, they don't really matter that much, except if you can get more than 80, then they do have an impact on which department you can. It has an impact on your specialization and your job as an intern/resident. It's not a major impact, but you can get more information about that once you're in med school. Now, here's a couple of common phrases or sayings in med school, just to show you that the scores don't matter. So the first one is P's get degrees. What is a P? P means pass. So even people who get 50%, they still end up with a degree. What do you call the person who graduates med school with the lowest marks in the cohort? You call them a doctor. because they still end up graduating with that degree. So my point here is your marks in med school don't matter. What about dent school? I would say that it's probably not easy too. I have talked to some DMD1, the first year dentistry students, and they have said that it's less chill. It's more chill than first year medicine. Well, if they compare it to their friends, usually they have less work to do. What have I seen? A DMD1 student, they've began hands-on stuff. So this is procedures and stuff like that. Whereas medicine students, they begin procedures and rotations and going to hospital in their second year. A DMD2 student, they told me they think med school is harder because their friends are usually more busy. A dentist who's now in med school, who's in my cohort, said he thinks they're probably about the same. So it's hard to say which one is easier, which one is harder. What about after university? This is the sad thing. The grind never really ends. If you are interested in a competitive specialty, so that means anything related to surgery, cardiology, gastroenterology, anesthesiology, radiology, which are all the main famous ones. You know, you see surgery in all of the medical dramas on TV. It takes a lot of effort after med school. A lot of effort. You have to do research. You have to suck up to your superiors. So it's really, really difficult, and it'll take a long time, especially for surgery. 10 to 15 years when you finally finish specializing. Less competitive specialties are easier to get into. They usually have a more relaxed lifestyle, but they usually pay less as well. So GPs, psychiatrists, emergency doctors are just a few examples. So before we talk about our individual experiences in med school, I will talk a little bit about what you should do before and after. What you should do if you don't get into medicine and if you're deciding whether to do medicine. So is med for you? If you're doing it for the money, as a med student and kind of knowing what's going to be coming up in the future, I would say it isn't worth it. There is a lot of effort for the amount of money you will get. Okay, the effort to money ratio is quite undesirable. If you're doing it for the prestige, so you can say to people, I'm a doctor, then I would say that you really need to be knowledgeable about whether you know what you're getting into. Okay? If you're doing it because you like it, then that's good. Okay? A lot of the doctors, that's not why they're doing it. They don't really like it. I think if you're doing it because you like it, that's a very good thing. If you're doing it because your parents want you to, again, I would say you should really know what you're getting into. And if you don't enjoy med school, it's better to, if you don't think you would enjoy it, it's better to not pursue it now rather than drop out of it later. Okay? It's better to make the decision earlier. If you're doing it because you want to be a surgeon, you want to be a cardiologist, you want to be a gastroenterologist, my advice is to be careful. Okay? There's no guarantees. If you talk to doctors these days, you ask them, did you always want to be a GP or did you always want to be a cardiologist? Then they might give you a different answer. Everybody's opinion or everybody's desires change in med school. Okay, as you do rotations in different departments in hospital or in clinics outside hospital. So you got to keep your mind open and make an informed decision later. So what if you don't get in? There's 4 different options that I'll talk about. Option number 1, give up and do something else. So if your reasons for doing medicine aren't exactly genuine, you're just doing it because you want money or you're doing it because your parents told you to, then I think you should give up and you should find something you like. Okay, that's my opinion. And the only person who knows if your reasons for wanting to do medicine are genuine is you. Okay, nobody else can really tell because it's the thoughts inside your head. Option 2, gap year and redo UCAT. So if your ATAR is good enough, then I recommend this. If your ATAR is not good enough, like it's a 90, if it's something in the 98s, then that's a little bit harder. Option 3, you can also redo some subjects if you take a gap year. So have a look at Cyril Jackson Senior Campus or speak to or message or contact us and we can help you with that as well because we have a few students who have done that or are doing that. Option 4, start a different degree, try to get into medicine postgrad. And I've put a couple of reasons there which you can have a look at. But the people who do this option 4, they tend to be more motivated and they end up usually, well, people say they end up being better doctors simply because they really know that they want to do medicine. Getting in postgrad is a very difficult route. And for the people who get in, it's just because they're more committed. Okay? More committed than the undergraduate students, usually. Okay. So I'll talk quickly about Academy 99 and then me, Sindhu and Nathan might talk about our experience in med school. So how can Academy 99 help? We do year 7 to 12 classes at different times during the week. Our year 11 to 12 classes are after school. Our year 7 to 10 classes are on the weekend. And our promotion currently is that we're free, that all classes are free until the end of term 2, provided that you are a new student or an existing student picking up a new subject. And those are our fees once you've finished your free trial. So I will just give you a few words of advice about how you should study for ATAR. Okay. I'll begin with one recommendation from me. I would say that the thing that helped me the most was just spamming practice tests, doing as many as I can. So 2 weeks before, 1 or 2 weeks before I had a test for mathematics and science subjects, I would try to revise all of the content and I would begin printing out and doing practice tests.
Just adding on to what Saad was saying, the most efficient way to study is definitely by doing as many practice tests as possible. The way we do this at Academy 99 is we'll go through booklets during class, and then we'll teach you all of the different question types and content needed so that you should be capable to do tests in your own time, right? Now, specifically for the maths and science subjects, if you can get your hands on resources such as the OT Lee booklet or through WACE exams, they're typically better than studying using the Sadler textbooks. This is mathematics specifically, just because the Sadler textbook, the style of questions is quite different from what you'll see in your tests and exams. So always be using test and exam questions. You might find them on the WACE Vault or actually the WACE Vault. That's a good thing to bring up. So there are resources that you can find online. If you join our tutoring, we can provide them for you, but if not, you can find them online as well.
So what about UCAT? In terms of studying for UCAT, the strategy that I used was to dedicate a portion of my time every single day to just do UCAT. So every day between about 6 to 8 a.m. before school started, I would be doing UCAT prep. How would I do UCAT prep? I used a UCAT preparation company, and the main thing I practiced was my speed. So I didn't go and do full UCAT practice exams. I only did small sections. So you might recall that Nathan told you that in verbal reasoning, you have a passage, and for that passage, you have to answer 4 questions. So what I would do is I would choose the option where I get 2 minutes to answer 4 questions. So that's what I would recommend. Set a fixed time for yourself every single day. Otherwise, you'll get overwhelmed by all of your school tasks. Another thing I would say is you need to get used to all of the keyboard shortcuts, and it would be useful to practice mental mathematics. That's very important for quantitative reasoning, as well as your speed reading. So in terms of UCAT preparation courses, I used a couple. I used MedEntry. So that is quite a useful resource because it has speed reading exercises, it has mental mathematics exercises, and it's very versatile in terms of all the options of practice tests you can do. What I mean by that is you don't have to do practice tests. You can set a timer. You can do 2 minutes worth of questions. So it was very good for practicing the speed, making sure I'm fast enough to get through all of the questions. Another one that I used when I got closer to the UCAT assessment was Medify, MEDIFY. So that is simply just practice tests, and it was a much more affordable price compared to MedEntry. So for these UCAT preparation courses, you can often get discounts if you sign up with a friend. So that's something you should maybe look into. What about interviews? How should you study? My opinion is that you shouldn't study for interviews, okay? Only after your WACE exam, when you have about 2 weeks until your interviews, if you get an interview offer, that's when you should be looking to study for interviews. So what should you be doing right now? I would just recommend you increase your confidence if that's possible. So this can be very, very little things. Okay? This could just simply be if you're at the shops and saying hi to the cashier, just simple things, talking to new people, having conversations with your friends' parents, something as simple as that. Just try to improve your confidence, and that can help you out when it comes to interviews. Okay, and the final thing is, I'm just going to go through just a summary of all the universities where you don't need UCAT and you don't need an interview. So if you really don't want to do UCAT, then you do need a very high ATAR. So I've just listed them here. JCU, which we talked about, it has the written application. Griffiths, Gold Coast, or Brisbane, you need a very high ATAR. And there's a few other quirks about Griffiths, such as the fact that whether you get a bonded place or a non-bonded place depends on your marks in your undergraduate degree. So a few special things about Griffiths. University of Melbourne, we've talked about the Chancellor's Scholarship. That's pretty much the best one in Australia. University of Sydney, very, very hard to get into. Dentistry, again, there's a few that don't really have the UCAT. Do you need an interview? In short, well, yes, unless you do really good in ATAR or UCAT or both. Okay, same idea for dentistry.